Fun. Grapefruit, the silent killer for people on medication. Although grapefruit is rich in vitamin C and antioxidants, it can pose a serious threat to individuals taking medications. Few people are aware that grapefruit can cause dangerous drug interactions, even life-threatening ones, especially among the elderly who are being treated for multiple chronic conditions. The main cause lies in grapefruit's ability to inhibit the activity of the enzyme CYP3A4 in the liver. This enzyme plays a critical role in the metabolism and breakdown of many medications. When this enzyme is inhibited, drugs cannot be properly eliminated, leading to excessive accumulation in the bloodstream. As a result, medications can become much more potent than the prescribed dose, potentially causing severe complications. Some common consequences include irregular heart rhythms, muscle breakdown, particularly with statin drugs used to lower cholesterol, excessive bleeding when taking blood thinners like warfarin, or enhanced side effects from sedatives and anti-anxiety medications. This is especially dangerous for older adults, who often take a combination of drugs such as blood pressure medication, lipid-lowering agents, anti-anxiety drugs, or anticoagulants. Alarmingly, even a small amount of grapefruit juice can have a prolonged effect on drug metabolism for several hours or even an entire day. Therefore, anyone on medication, especially the elderly, should consult a doctor or pharmacist before consuming grapefruit or grapefruit juice. This small precaution can help prevent serious complications and may even save lives. 2. Cherries, sweet but risky for diabetics and arthritis. Patience cherries, also known as sweet cherries, have long been favored for their refreshing taste, vibrant color, and association with youth and vitality. However, for older adults, particularly those living with diabetes or arthritis, this seemingly harmless fruit can become a double-edged sword for health. One of the most notable features of cherries is their high natural sugar content, about 20 grams of sugar per cup of fresh cherries. While this is natural sugar, the body, especially in individuals with diabetes or insulin resistance, still reacts by spiking blood sugar levels. Rapid blood sugar spikes can cause fatigue and thirst and, over time, damage blood vessels, nerves, and vital organs like the heart, kidneys, and eyes. Additionally, cherries are a highly acidic fruit. For those with arthritis, especially rheumatoid or osteoarthritis, consuming too many acidic foods can worsen inflammation, pain, and joint stiffness. Although some studies suggest cherries contain anthocyanins, anti-inflammatory compounds, the benefits only occur when consumed in moderation and within the context of a balanced diet. Overconsumption or using concentrated forms like juice or dried cherries, which are higher in sugar and acidity, increases the risks. What's more concerning is that seniors often experience diminished satiety cues and poorer portion control, making them more likely to overeat sweet fruits like cherries without realizing the potential consequences. Therefore, if you have diabetes, insulin resistance, or a history of arthritis, be cautious with this fruit. Replacing cherries with lower sugar, high fiber, and more alkaline options like apples, blueberries, or papaya may be a safer and more beneficial long-term choice. 3. Bananas, the golden fruit. Can be hazardous if misused. Bananas are widely known as a nutritious, easily digestible fruit rich in potassium, a key mineral that helps regulate blood pressure and maintain proper muscle and heart function. However, the high potassium content in bananas can pose health risks to certain individuals, especially older adults with kidney disease, heart conditions, or those taking specific medications. In healthy individuals, the kidneys help filter and maintain potassium balance in the bloodstream. But when kidney function is impaired, a common issue among seniors, potassium may not be properly eliminated, leading to hyperkalemia, high potassium levels in the blood. Eating too many bananas when kidney function is compromised can result in potassium buildup, causing serious consequences. Hyperkalemia can lead to symptoms such as irregular heartbeat, muscle weakness, fatigue, dizziness, and even loss of consciousness if not addressed promptly. People taking medications for high blood pressure, such as ACE inhibitors or potassium-sparing diuretics, are at even greater risk as these drugs reduce the body's ability to excrete potassium. A medium banana contains around 400 to 450 milligrams of potassium. Eating several a day may seem harmless, but for high-risk individuals, this can quickly push potassium levels beyond the safe threshold. Alarmingly, hyperkalemia often shows no clear symptoms in its early stages, leading patients to be unaware until severe complications occur. Therefore, if you have kidney disease, heart disease, or are taking blood pressure medication, consult a doctor or dietitian before incorporating bananas regularly into your diet. This careful approach can help you gain the benefits of bananas without facing hidden dangers. 4. Dried fruits. Hidden sugar bombs that threaten seniors' health. Dried fruits are often considered a healthy snack choice, especially for older adults trying to avoid processed sweets or fried snacks. However, beneath this seemingly harmless exterior lie hidden health risks, particularly for those with diabetes, cardiovascular disease, or metabolic issues. When fruit is dried, nearly all of its water content is removed, causing the natural sugars in the fruit to become highly concentrated. For example, a handful of fresh grapes might contain about 15 grams of sugar, but the same amount in the form of raisins holds that much sugar in just a few spoonfuls, making it easy to overconsume without realizing. Furthermore, many dried fruits are coated with added sugar or contain preservatives like sulfites, further increasing their potential harm. Once consumed, dried fruits cause rapid spikes in blood sugar levels, which is especially dangerous for those with diabetes or insulin resistance. Additionally, because the fiber content is not as intact as in fresh fruits, dried fruits can cause bloating, abdominal discomfort, or diarrhea. Notably, sulfites in some products can trigger asthma attacks, migraines, or gastrointestinal inflammation in sensitive individuals. In reality, many seniors mistakenly believe dried fruits are healthy snacks, but fail to recognize how these foods can quietly overburden their aging metabolic systems. Thus, if older adults wish to consume dried fruit, they should choose varieties without added sugar or preservatives and consume them in very small quantities as part of a carefully controlled diet.